Okay, so we are going to start. Welcome, everyone. My name is Jan Fisher, and I am the Executive Director of Nonprofit Westchester. I am thrilled to launch Community Assets today. This is a free virtual monthly community education series to connect Westchester residents, employers, and employees to the wealth of nonprofit and government resources designed to optimize personal and family well-being, positive connections to the workplace, and overall employee performance, and more inclusive and supportive communities. I want to thank the Westchester County Board of Legislators and County Executive George Latimer and his team for funding this monthly series, and to New York-Presbyterian for sponsoring today's program. Before I begin, I want to remind you that the March Asset Series program will focus on pronouns, allyship, and the LGBT+ community, what they mean and why it matters. All information on NPW events can be found at npwestchester.org. We are starting this series with promoting mental health. We know that this is so important given pre-COVID realities related to mental illness, substance use, and suicide, and what now amounts to a public health crisis. This impacts every community, every business, and every family. We are so fortunate to have 3 experts with us today to discuss the resources available to support businesses, schools, communities, families, and individuals. Michael Orth, Westchester County Commissioner of Mental Health. Marie Considine, Executive Director, NAMI Westchester. And Michael Radosta, Vice President of Behavioral Health and Patient Care Services and Chief Nursing Officer of Behavioral Health for New York-Presbyterian Hospital. They will each take some time to speak, starting with Commissioner Orth. I ask that you put your questions in the chat, and we will do our best to get them answered today during this webinar after our speakers have finished. And if that's not possible, we will work on getting you the answers you need after this webinar. It is my pleasure to introduce my friend and colleague, Michael Orth.
Good afternoon, everyone. And Jan, thank you so much for having us. And we are going to do our best to try to give you as much information in a relatively short period of time. But as Jan said, we really appreciate your commitment to this most important conversation, and thank you for being here. We're really excited to help launch Nonprofit Westchester Asset Series, and kudos to Nonprofit Westchester for starting off with mental health. The mental health of our children, our communities, our families, our places of work is so important and impacts so many aspects of our society. It is imperative that we collectively address mental health and wellness of our residents. And for those of you who don't know, Jan has always been a champion of mental health. She actually helped bring mental health first aid to Westchester County in, I think it was 2013. So Jan, thank you for always supporting our efforts. And as you mentioned, I also would like to acknowledge our County Executive, George Latimer, our Board of Legislators, for their unprecedented commitment and support to the mental health and wellness of our community. I say that with sincere gratitude, having worked in the county for over 30 years, but we also recognize that there is a significant need as well. And as Jan mentioned, I have the pleasure of serving as the Commissioner of the Department of Community Mental Health. And essentially, we're a branch of county government that has responsibility for the mental health, substance use, and developmental intellectual disability system for Westchester County. And that includes education, awareness, early intervention, treatment, and recovery. And we do this in partnership with stakeholders. I'm always proud. The title of our department is Department of Community Mental Health. And that really emphasizes that this is truly a community effort. We all have an important role to play, and includes family, neighbors, places of employment, police, friends, coaches, faith. We all have an important role to address the mental health needs of our communities. And it's essential, as we're doing today, connect with our partners to provide the education, the tools, and the support to help those in need. I want to spend a little time talking about why this is such an important issue and a sense of urgency. The Surgeon General in the United States first recognized mental health as a public health issue back in 1999. And more recently, in 2021, the Surgeon General released an advisory on youth mental health. And just this past summer, a media advisory for youth also on social media. And we've been hearing some of the testimony in Washington recently about the impact of social media as well. So I'm going to touch on that as well a little bit. But it's important that mental health be recognized as a public health issue, because with that promotes research, prevention, early intervention, and the use of evidence-based practices. And when you look at some of the earlier crises as related to public health, when we look at traffic fatalities, since it became a public health issue, 54% improvement in fatalities. Breast cancer has declined by 42%, and smoking has declined by 21%. And when we look at why, it's because there's more awareness, there's screening, there's enforcement, advances in treatment, but also prioritizing resources and programs as well. Now let's take a look at behavioral health and fatalities. And when we talk about behavioral health, we're talking about mental health, depression, anxiety. We're talking also about substance misuse, because we know the correlation between substance misuse and having a mental health issue. And we're also talking about suicide, which is often something that is a final act for people who are struggling with mental health and or substance misuse. So it is truly one of the greatest public health crises in our country, and perhaps throughout the entire world is facing. Fatalities have gone up over the past several years. In 2023 alone, in the United States, there have been 50,000 completed suicides, alcohol-related fatalities 100,000, and fatal overdoses 112,000, which totals almost 262,000 residents of the United States who have died with this behavioral health issue and challenge. So clearly, it's one of the greatest public health issues that we're facing. And when you look at why, we have to talk about stigma. We have to talk about historical messaging about mental illness and our societal reactions to emotional pain, how we address it and dealing with it, blame, shame, forced to struggle in silence. And then we're also going to touch a little bit about access to mental health services, including parity and health insurance, and also investment in services. But the reality is we've all been impacted and have someone close to us who've been impacted by mental health and substance misuse. We also know that 50% of all lifetime mental health disorders begin by the age of 14 and 75% by age 24. So think about that. Begin by age 14 and 75% by the age of 24. And the average time from the first symptom to actually receiving help is 12 years. Now, if you can imagine, if you had a other health issue of significance, waiting 12 years to even seek treatment for the first time. So let's touch a little bit about our probably most cherished resource, our children and youth. 16% of youth reporting from at least one major depressive episode this past year. 3.8 million youths are experiencing major depression. 60% of youth with major depression do not receive mental health treatment. 1 in 3, and it's probably even a higher percentage, youth experience anxiety. 43% of youth in the United States receiving mental health services were also identified as having a co-occurring substance use disorder. The numbers go on and on. 19% of high school students have seriously considered suicide. 16% made a plan. 9% reported and attempted suicide. And almost 3% of our young people attempt required medical attention. And more recently, as it relates to social media, and this is interesting to think about our own families, children and adolescents who spend more than 3 hours a day on social media face double the risk of poor mental health, including experiencing symptoms of depression and anxiety. This is deeply concerning, as a recent survey of teenagers showed that on the average, they spend 3.5 hours a day on social media. And when you talk about getting help, 1 in 2 youth with private insurance do not have coverage for mental health services. And when we look on our adult population, not to spend a lot of time on data, but 21% of adults are experiencing a mental illness. 55% of adults with mental illness receive no treatment. And think about that, their impact on their parenting, on their functioning in society and in the workplace. 12% of adults with a mental illness are uninsured. And mental health crises account for 60 million visits to primary care and 6 million emergency room visits annually. Adults living in the US living with serious mental illness die on the average of 25 years earlier than others, largely due to treatable medical conditions. As it relates to our veterans, each day an estimated 18 to 20 veterans die by suicide. And finally, which is also a major concern in our county and across the state and country, in the US, there are 35 individuals for every one mental health provider. So when we talk about resources and our workplace issue, and we all know that Westchester County is not immune from these issues. In 2018, our county executive issued a transition report and surveyed Westchester residents on the #1 health issues we're facing. And not surprisingly, and this was before our pandemic, the #1 health issue that Westchester residents disclosed was mental health and suicides, followed second by substance misuse and overdose. And when asked which of the following are the most needed to have a positive impact on the overall health of Westchester residents, overwhelmingly 64% of the residents said mental health services. So what needs to be done here in Westchester County, and what are we doing? As Jan alluded to, in Westchester County, we use a framework called the system of care approach. And basically that involves all of us having a key role, whether it's prevention, early intervention, treatment, recovery, and support. It's built on principles and core values that we all hold ourselves accountable to, which includes immediate access, racially, culturally, and linguistically competent care. Also recognizing non-traditional credible messengers, which I'll touch on, are just as important as those traditional services. So when we look at prevention, education, awareness, often the front line of how people first hear about services and get help. In Westchester County, we've supported mental health first aid, which is sort of like the CPR in our mental health field. So if you're working in a school, college, in a workplace, they now have mental health first aid for youth, for college students, for adults, mental health first aid at the workplace, and also mental health first aid for first responders and veterans. And these are 6-hour curriculums that are tailored to the population who we wish to address. In Westchester, we've also had a great focus on co-occurring disorders, or CODA. Thanks to Stephanie Marquezine on the Harris Project, we're really looking at the relationship between co-occurring disorders and getting into the schools to really educate folks. And of course, in a few minutes, you'll hear from Marie from NAMI talking about the various programs and educational opportunities that they have that really reach the community. In Westchester, we also believe that our faith-based spiritual community are pivotal and a place of healing where many people go to get support. So we've worked with our faith-based community. There's now a curriculum called Soul Shop, which has hit many churches and religious institutions that really look at how we can integrate faith-based and the mental health language. We also are doing a lot of work with peers and credible messengers. We know that we don't do a great job really connecting to various communities, whether it's a language barrier, whether it's a cultural barrier, but it's imperative that we work closely with our community partners really to get the services out and really make sure that we're meeting everyone's needs. The next thing that I really wanted to focus on, you'll hear from our speakers, including Michael and a few, is really treatment. Just as we have urgent care centers almost in every street corner now in Westchester, people who are experiencing signs and symptoms of mental health, it's important that they have timely access to effective services, not waiting 12 years, not being put on a waiting list, or not being denied with insurance. We also recognize that people often have other co-occurring issues, whether it's social determinants of health, whether it may be trauma. So how are we addressing and getting the services to those individuals? We also are really looking at use of evidence-based practices and promising practice that really support all people from whatever community, whatever culture, race, or language they speak. One of the things that I think in Westchester we've really made as a priority is really delivering services where people are at. You don't now have to go to a clinic. There's other ways. We have over 70 school buildings in Westchester County now that have school-based mental health satellite clinics. And many of you on this webinar, actually, your agency is providing those services where we actually have clinics set up in schools. So we know that people have greater access. You don't have to wait to after school, and it's part of your school programming, so to speak. Thanks to many on the call, we also have now mental health services in early childhood and Head Start, where we can really have an impact with classrooms, with parents, and with young kids at a much earlier age. We also have mobile mental health services where we're really meeting people either at home, in the community, or wherever they're most comfortable. And many of our faith-based organizations now have counseling centers, or we're in health centers, and we also have services in county corrections. So these are a few different ways of delivering services. Marie and Mike will also talk in a few about offering a continuum of services that just like with a medical issue, you don't always go to the hospital. There's outpatient services. We have care management that will help you create a mental health and wellness plan, and also the importance of peer services, respite services, and of course, for those who need a hospital level of care as well. So these are all part of what we call the continuum of services that we want to make sure the right fit for each person who may need those services. And finally, I'd like to spend a few minutes talking about some of the more exciting initiatives here in Westchester County that our county department has been able to do with the support of the county executive, the Board of Legislators, but also with many of the stakeholders out in our communities. Many of you have heard about reimagining police, really where each county and state, we're really looking at police response and how we can prevent murders that occur throughout this country. And in 2021, Westchester released their reimagining police plan, and we created something called Project Alliance, which is really a multi-pronged approach, really supporting police officers, but more importantly, those individuals who are in a state of behavioral health crisis and need immediate, compassionate support. So in Westchester, we created 5 mobile crisis response teams that are connected to every police department in Westchester. And whenever there is a call for a behavioral health crisis, there'll either be a co-response with police and mental health, perhaps it just requires a mental health response, or first there's really a risk and safety issue, but the mental health team will be on site as well. We've served over 1,000+ people in Westchester since we embarked on this really innovative response, and we're proud to say that we're really making a difference as well in terms of how we provide a more appropriate, compassionate response to a behavioral health crisis. Also been providing crisis intervention training for police officers. We exceed the state requirement. We provide over 70 hours of training to police officers on de-escalation, understanding mental health, other disabilities, a lot of role playing, so they're better equipped at responding to a behavioral health crisis in our community. And finally, we also have now the National Suicide Hotline, Crisis Hotline, which used to be a number that when someone's in crisis, forget about remembering the number. Now it's 988 nationally. So thanks to our county executive, we invested funds at St. Vincent's Hospital, who is now our 988 designated suicide crisis 24/7 line. Previous to this past summer, all the calls would go to Syracuse. I hear they have very nice people in Syracuse, but they don't know our local service system. So we've received thousands of calls since the start of 988 at St. Vincent's, and they understand our various continuum of services, including peer services, including NAMI, or when a crisis team really has to respond to a call. So we're really fortunate to have those resources in our county. The other thing many folks have heard about, thanks to our Attorney General, we now have the opiate abatement settlement funds that counties received an allocation to not only address opioids, but also mental health, prevention, harm reduction. So we're fortunate to have spent significant funding to our community-based providers to really spend funding on expanding treatment for co-occurring disorder, for looking at prevention in schools, not only mental health, but substance misuse. We've added harm reduction to really increase capacity, and we're also working with community providers to really make sure we're serving those folks in the community. So as you can see, there's a lot to talk about. Clearly, we're in a public health crisis as it relates to mental health, but we're excited to see so many of you participate in this call, and we hope that this can be the beginning of a conversation about how you can support the mental health of your work site, of your community, or of your organization. And think about, even as an employer, what services can you put into place in terms of prevention, in terms of mental health first aid, or when someone is struggling, do you feel confident in accessing services? So we look forward to a continued dialogue. And without further ado, it's my pleasure to introduce Michael Radosta, who is the Vice President of Behavioral Health and Patient Care Services, Chief Nursing Officer of Behavioral Health at NewYork-Pres. So Michael, thank you for joining us, and I'll turn it over to you.
Well, good afternoon, and thank you for this tremendous opportunity to be part of this crucial dialogue. And thank you, Michael, for laying the framework for this conversation. Obviously, it can be daunting, those numbers, those figures that you were throwing out earlier, but I believe we are all aligned and that there is hope for the future, and it is a bright one. You made reference of all the great services currently occurring through your team's efforts, but we also recognize that the work is not done. There's room for improvement. And through increased cooperation between these resources, access to care will only benefit the end users. So I appreciate that. Thank you very much. I'm honored to be part of this panel and representing the NYP workforce dedicated to serving this population. I'll start by providing context to New York Presbyterian's current and growing infrastructure. New York Presbyterian is a world-class academic medical center committed to excellence in patient care, research, education, and community service. In collaboration with two renowned medical schools, Weill Cornell Medicine and Columbia University Vagelos College of Physicians and Surgeons, NYP is consistently recognized as a leader in medical education, world-class nursing care, groundbreaking research, and innovative patient-centered clinical care. With that being said, NYP is heavily invested and continues to expand our behavioral health services to meet the growing demands within the communities we serve. With currently over 500 inpatient behavioral health beds spanning 5 locations from White Plains to Brooklyn, we have one of the largest behavioral health footprints in the nation. With 2 internationally recognized freestanding behavioral health sites, both magnet designated and Plaintree Gold certified, which means we deliver the best-in-class quality patient experience and employee engagement outcomes. We also have 3 other locations that are in general medical settings that include Weill Cornell, Columbia, and New York Presbyterian Brooklyn Methodist Hospital. Westchester Behavioral Health, which you'll see behind me here on my screens, my background, the Zoom background, this is the main entrance to our facility, is located in White Plains, and for a point of reference, it's across from the Westchester Mall. It has over 240 inpatient beds sitting on top of over 110 gorgeous acres, and it's been here for over 125 years. As we like to say, they don't make it like they used to, right? So this place is going to be here for the next 125 for sure. The second is at Gracie Square Hospital. And that's another freestanding site within our, and when I say freestanding, it means dedicated only solely to behavioral health needs. The second is Gracie Square Hospital, located in the Upper East Side of Manhattan, and that has 140 inpatient beds and is the only freestanding behavioral health site in Manhattan. It's making it really a gem in that diverse community, and it's celebrating its 65th year of service currently this year. COVID accelerated the national attention on the behavioral health epidemic, in particular the crisis level of child and adolescents impacted. With this spotlight has come increased federal and state funding for programs, all too soon to determine the impact, but the future, like I said, is bright, and we are heading in the right direction to build meaningful infrastructure to support early intervention, acute care, and long-term stabilization within our community. While devastating, there were some silver linings to COVID in that it helped us create new care delivery models, highly inclusive of technology, to reach a broader degree of patients, both through telepsychiatry and the ability to engage those in isolation via iPads in a manner that did not neglect the quality and the dignity of the care that they received. At NYP, we were at the epicenter. We were the first hit by COVID, and therefore the first to create these innovative ways to provide a healing environment whilst ensuring the safety of our patients and staff. And we disseminated our approach nationally in real time and later through publications. The individuals that we currently serve are complex. It's only getting more and more challenging to place these individuals in the limited outpatient infrastructure that we find within our community settings. And in particular, their medical acuity has grown with multiple chronic comorbidities, as well as the level of psychiatric acuity. The level of violence associated with psychiatric illness is still sensationalized through media. And while in fact, this is still on par with the general unraveling of social norms within our communities, unfortunately. To meet these ongoing demands, we are currently undergoing unprecedented revitalization and expansion of our services to increase access to care. We're continuing our efforts to modernize all current inpatient units, ensuring contemporary and state-of-the-art healing environments while simultaneously growing our services. We are expanding our medical capabilities, inclusive of psychiatric medical beds. And due to philanthropy, we've been very fortunate that the Steve and Alexandria Cohen Foundation recently made a significant contribution. We're going to be able to expand our current child and adolescent inpatient capacity here at Westchester Behavioral Health, and adding also an ambulatory outpatient child and adolescent program to our site for the first time. So that increased child and adolescent services that we're going to be offering will be coming to fruition in 2025. And we're very fortunate to have been able to receive that donation. We believe it's the first of many to come. Based on the community's needs, our inpatient units, I mean, are consistently, specializing in the care that we deliver. So we look at our treatment tracks, and we try to meet the unique challenges of those that we're serving. So at Westchester Behavioral Health, each unit specializes in the care of a certain population, which enhances the programmatic experience and ultimately their outcomes. To mention a few, we have an eating disorders unit, one of very few to speak of nationally, and it is nationally recognized as a gold standard, both for adolescents and adults that eating disorders program is able to serve. We have a college track, which is focusing on first breaks, psychotic first breaks in particular, substance abuse program, an Orthodox Jewish unit, women's unit, and a growing electroconvulsive therapy inpatient ambulatory program, and so on. So this is the first year that we actually introduced ambulatory ECT as well, and we're seeing that there's a tremendous demand for it. Our ambulatory outpatient programs, including partial hospitalization program, are also under revitalization efforts, which will increase the efficiency and access to care. In early 2023, we hired a new vice chair of ambulatory service, Dr. Justin Chen. The year was spent conducting a deep assessment, and we are looking forward to rolling out a transformed ambulatory program, and look forward to detailing more of that in the near future. But that's going to be from here in White Plains all the way down to Brooklyn, where we're opening additional outpatient services in the Brooklyn community as well. All of our inpatient beds are overseen by our access center, which is our air traffic control, coordinating and ensuring efficiency and ease of placement for anyone needing psych admission, coming from Hudson Valley to Brooklyn again, and all external referrals as well. We're also home to the Center for Autism in the Developing Brain. We call it the CADB, where patients and families can receive comprehensive evaluation, treatment, education, and support customized to their individual needs at all stages of life. And we do know that the autism population is of significant concern within our communities, and apparently continues to grow as well. Supporting all of these programs are the most engaged and empathetic interdisciplinary teams you can find. I'm very privileged to be in the position I am. I have oversight of the entire service line, and I got to tell you, it's the best staff I've ever worked with in my life. All of our staff practice in an environment that fosters their ability to work to the very top of their professional licensures. And additionally, we believe everyone has equal voice in the care of our patients, from our EVS, food and nutrition staff, to our support staff in the background. Everyone has an integral part in the care of the patients that we receive. And that's what I think drives some of the best-in-class experience of our patients as well. We believe also that the families and loved ones of our patients are critical stakeholders. Hence, we have a robust care partner program ensuring alliance and integration with the treatment team, so that as to further support the transition of the patient back to their outside life with tremendous success. And we have leaders that have currently and have in the past sat on the NAMI board, and we're very privileged to say that we have a great partnership with NAMI as well. While we are seemingly on the best track we have seen in several decades. We must ensure that this attention that we're receiving and this investment that we're receiving is it does not dissipate, right? We want to continue to prioritize mental health in all aspects of our lives. And there's an opportunity here to increase synergy between agencies and programs to ease the burden of access. An example is our dialogues with Westchester Jewish Community Services in relationships to our substance abuse program. We recently had a presentation by WJCS, and we believe that there can be increased synergy there as they have outpatient infrastructure, we have the inpatient infrastructure, and we can build a tremendous partnership. Our community board is full of amazing organizations, and through our support and theirs, we know that we're going to continue to make a difference. I'm going to turn it over now to Marie Considine from NAMI.
Hi, everybody. Thank you so much to Jan and to Nonprofit Westchester and to the county and Michael for making mental health a priority. As Commissioner Orth mentioned, mental health needs and suicide rates are increasing, and we are indeed in a mental health crisis. As the Surgeon General identified, social media and COVID have greatly impacted the mental health of our youth and have drastically increased the need for services. I'll tell you a little bit about NAMI Westchester. We are an affiliate of the National Alliance on Mental Illness. There's one national organization and 600 affiliates nationwide, including 23 in New York State. This year, NAMI Westchester is celebrating our 40th year, celebrating all of the work that we've done, supporting, educating, and advocating for 500,000 Westchester residents over that time. NAMI is a grassroots organization. We're dedicated to improving the quality of life for individuals and families whose lives are affected by mental illness and co-occurring disorders. So as I mentioned, we support, educate, and advocate. So I'll just let you know a little bit about each of those and kind of how it involves the community, because it's more than what our NAMI signature programs are. It's really what are we doing for the residents of the county, and I want to let you know about that. So the ways that we support Westchester residents, we support people who are living with mental health diagnoses and their families and loved ones. So we have peer support groups, which are both offered in person in our office space in Elmsford, as well as virtually. That's called NAMI Connection, and it's run by and for people who have lived experience. We also have support groups for family members and loved ones to give them support as they help their people who are in their family and help them kind of get through those challenges, and those are offered monthly. So we, in addition to those support groups, we have a 90-minute webinar called Family and Friends, and the next one coming up, it will be held on the evening of February 21st, and the registration is on our website. And that is really a 90-minute webinar that's kind of Mental Health 101. It's a mini version of one of our larger programs, which I'll mention in a little bit. But that's a really great way to learn about how to support your loved one, kind of what you need to know. We have several special events throughout the year where we support people living with mental health diagnoses. One is called Art Expressions. That's held each December. It's kind of our big holiday event held at St. Vincent's Hospital, and it's a great way for people who live with mental health diagnosis, who are adults who are living in recovery, to express themselves and share their artwork. And it's a really very nice event held every year. We have an art therapy group that's going to be launching soon. We held an International Survivors of Suicide Loss Day in November. That day is always the third Saturday of November, so we had a special day this year where we lit some luminaries and read a poem at the county's Healing Garden. So if you haven't heard about the Healing Garden, that's something that we worked very closely with Westchester County Department of Community Mental Health and our Suicide Prevention Task Force. It's a really great group who came together, meeting of the minds, and we created a beautiful sanctuary carved out as part of Ridge Road Park, which is in Hartsdale. It's a county park that doesn't have an admittance fee, and it's pretty level. So people of all abilities are able to navigate that park. And the Healing Garden is a beautiful spot with plantings and a bench and a stone that's dedicated and a kiosk that has some resources. So it's a really nice place to go and visit, just to think about, contemplate, remember someone you may have lost to suicide. It's very comforting, and hope that you visit. One of the things that was the very first thing that NAMI Westchester did when it began 40 years ago was start a helpline. So our helpline is open 9 a.m. to 3 p.m. Monday through Friday. It's not a crisis number, but it's a helpline. So we get calls from anyone who has a question about mental health resources in the county, how to help a loved one, how to help themselves. So we provide information, not just information about our programs, but resources in the county. So pretty much every nonprofit you can think of in the county, if you look at Nonprofit Westchester's member list, we've referred to all of them at different times. People might call us for domestic violence or for housing or for anything. We help them with all those questions. Sometimes we're the last call they make, and then sometimes we get calls with people who are crying and just really need an ear to listen. And the calls are answered by people who've been there, whether it's a family member or a peer. So that's mainly how we support Westchester residents. The ways that we educate the community on mental wellness, mental health conditions, and serious mental illness. We have an 8-week program, which is a 20-hour course, 2.5 hours a week, called Family to Family. And it's a wonderful program that provides mental health supports, how to help your loved one, crisis planning, really how to set up that continuity of care that Commissioner Orth mentioned earlier, really set that up for your loved one. And that in itself really becomes an amazingly supportive group that you really build over the course of the 8 weeks. We have a similar program called Homefront. That's a multi-week course for family and friends of veterans. And then another similar one that's called NAMI Basics, which is a similar educational program, but it's for people who have family members who are young. So that's really for people who have children and are really learning about mental health, how to help. And that right now is asynchronous. You can take it at your own speed online. The other programs, Family to Family, for instance, is taught live by 2 trained people who have taken the program, how to live a loved one with a mental health diagnosis. So they really bring the lived experience to the program. A very important program that you may have heard of is called Ending the Silence. So that's a program that's evidence-based, and it's a suicide prevention program where that we provide to youth, staff, and parents right in the schools, in middle schools and high schools. So it's really an education about mental health warning signs, suicide warning signs, how to identify a loved one, trusted adult, I should say. And then the program hands off to a young person who shares their personal journey, who talks about themselves and their struggles and how they got diagnosed and what has helped them and how they're living in recovery today. And more often than not, there is a young person who shares at the end, self-identify, saying that's me, or that's my friend, and how do I get help? And we're able to make that connection. That's Ending the Silence. So we work very much with other organizations. We collaborate with other nonprofits in the county. We attend their events, they attend ours, and we're supportive with other missions that we can't fully engage in what we do, but we do it as ancillary with others. So we have an upcoming educational event on April 10th called College Transition and Your Mental Health, Empower Your Path. We have a keynote speaker, Dr. Marjorie Seidenfeld. We have a panel discussion, representative of all parts of the population of young people. It'll be held at Pace University on April 10th. And it's mainly geared toward high school students, their parents and guardians, 2-year college students, young people engaged in a gap year, high school guidance professionals and advising departments in colleges, really to help young people make that transition from high school to whatever's next. And through all these programs, we use respectful, peer supportive language, and we often share NAMI media guidelines with local broadcasters to really let them know how to talk about mental health, how to talk about suicide, what's appropriate and what's respectful. The last kind of point I'll bring up, I said we support, educate, and advocate. So some of the ways that I wanted you to know we advocate, and this is an invitation to please get involved with us and let us help you, and you can help our efforts. So we advocate for access to services, treatment, support, and research, and we're really committed to raising awareness and building a community of hope for everyone in need, which is basically everyone right now. We offer the kind of understanding that only people who have lived experience can provide. As per NAMI, the 2023 statistic states that 49% of youth ages 6 to 17 with a mental health disorder did not receive services in a given year. That's a 2023 statistic. So half of the people who would have a diagnosis and need help are not getting the help. So that's why we do outreach and this education and this kind of a forum like here today to get the word out and let people know that we're here and we're working in the county and with others. Local statistics from Westchester Children's Association provides great information relating to local issues. And we use that information to inform our work. We teach individuals and families how to self-advocate, how to navigate, how to find help through the family-to-family program that I mentioned. We also have an In Our Own Voice presentation program, which we do at NewYork-Presbyterian, at Phelps, at St. Vincent's Hospital, some other hospitals, but also to community groups who bring us in. We recently did some to some Rotaries. New York State Rotaries now have a priority for mental health, which is wonderful. So we do a two-part In Our Own Voice presentation program where two people with lived experience, that meaning they have mental health diagnosis and they're in recovery, share their journeys to really put a face, put a name, put a voice to people to share what they are experiencing, to really help people understand. And a kind of subgroup of the In Our Own Voice presentation is a Bridges of Hope presentation. That's part of our FaithNet initiative. Commissioner Orth mentioned the Soul Shop initiative that the county has, which is the faith planning collaboration, and we are part of that. And we've done a number of presentations during the Soul Shop sessions, which means that people who live with mental health diagnosis share their journeys, but specifically if their journey to recovery included reliance on their faith, we include that. Then we educate leaders of houses of worship on mental health. Couple more things. Recently, we held a town hall when we provided information. It was called NAMI Smarts for Advocacy. So we let people know how they can self-advocate, how they can become advocates. So we talk about legislation that impacts lives. It really gives voice to those who have experience. We meet directly with legislators and we participate in press conferences on relevant topics. Some recent topics include a priority of installing means restrictions on bridges that was held in September, the launch of the New York State Green Light Law that was held a few weeks ago in January, and we support the NAMI New York State Legislative Action Agenda. One of this year's legislative priorities include, I should say, requiring 988, the life-saving suicide prevention talk and text line on college IDs, as well as Nicole's Law for discharge planning and many more. If anyone's interested in finding out about that, I can get that to you. I'll just close with letting you know that through all these efforts, sharing personal stories, and that's what every one of the programs I described does, is gives people with lived experience a voice and gives them the opportunity to share their story. And that's often very therapeutic. And it's a great support to someone's recovery. So the people who teach our educational programs and facilitate our support groups and speak in our presentation programs are people who have this lived experience, meaning they or their loved ones have mental health diagnosis. And I'll just echo the others in stating that early intervention is key. The earlier help is accessed, the higher the rate of recovery. So feel free to, reach out to us. Let us know how we can help you. because what we like to say that we do is we provide help and hope. And we're here. So thank you.
Well, thank you so much, both Michael and Marie. And Jan and I have been able to gather some of the questions and really wanted to, in our remaining minutes, hear from you folks, but also have more of a dialogue. And Jan, I don't know if you want to kick it off or do you want me to?
I will kick it off. And first of all, by thanking all of you. There obviously, for the participants, you see there is a wealth of information and a wealth of resources in our county. So thank you for sharing that. And thank you for the providers that are also on this webinar. There are many other organizations that do this important work, and they're on here as well. So I'm going to go in order of the questions. I do want to, since I am really, really supportive of any effort that can destigmatize mental health and any effort that can educate the community, I'm going to ask my question first, which is to you, Michael. I am a big supporter of the mental health first aid training, and I'd like to go into that a little bit more because I really want businesses of all types, whether for-profit or not-for-profit, to really understand how important this training is. You know, many organizations and businesses have to provide CPR training, which is an 8-hour course. And if you use CPR once in your life, that's a lot for physical health. But for mental health, having taken the course, I use it every day, and I do believe it's life-saving. So, Michael, could you just expand a little bit on, I think I want to focus in the workplace, why you feel this training is so important to do it in the workplace for employers to make their places of business better and for everyone.
Yeah, thank you, Jan. And it's a relatively new training curriculum that the National Council has put out. And Westchester was one of 3 counties in the country that piloted it 2 years ago. And they really train human resource managers at a much more intensive level, but then they also do a general one for the workplace. And it's really helping us understand signs and symptoms when you notice a staff member may be acting different than they had in the past. And it gives you the tools to first recognize that something may be different or concerning, but then more importantly, how to engage in that conversation so it doesn't become negative or become somewhat combative, and then how to help get that person support. So it includes also things like listing various resources within the general setting. What are some of the signs and symptoms, who to speak to after you do have these concerns. So it gives employees the tools to really address and then really help that person before it escalates even further. So it's a very step-by-step approach, as Jan knows. It's identifying, recognizing, appropriately addressing, and then trying to provide some support.
Thank you. So I'm going to start with the first question, which is, what mechanisms are in place for individuals over 18 who are resistant to engaging in treatment and are considered adults whose judgment is impaired by the said mental health issues that they need help for?
Yeah, I can start, but I'm sure Marie and Mike both have certain thoughts about that. We've really invested recently in various techniques like motivational interviewing. We also know that sometimes speaking to someone with shared lived experience is a great way of perhaps engaging someone that they may have been resistant to talking to a professional, quote unquote. We do have, for situations, and this is a state law, assisted outpatient treatment as part of Canberra's law many years ago. So if there is an adult who is at serious imminent risk for hurting self or others due to behavioral health issues, our department, as other county departments do, have the ability to request a court order for treatment. We still try to keep it very person-centered, respectful of the person. We have case management. The person is still in charge, so to speak, but it does have that court leverage if a person is, for a variety of reasons, unable to voluntarily engage in services. It's a tool, it's not a solution. We've had great success in Westchester County, And of course, we'll try all those other areas like motivational interviewing, case management, and really try to connect them with peers as well. Marie, Mike, do you guys want to respond to that as well?
I'd be happy to jump in on the inpatient side, and Marie, I'm sure that you have comments as well. We, to your point, Michael, I mean, that's exactly what we do. We work very closely with mental hygiene legal services for those that are involuntarily committed to our care. We want to ensure their dignity, respect, and we have empathy for the patients and their loved ones for when this is occurring, because it can be very traumatic. We work with peer specialists, and in fact, we just recently started to engage peer specialists and have hired several in our CPEPs, our psychiatric EDs, both at Weill Cornell and at Columbia, to start those dialogues early in a person's interactions with us. But yeah, when we have to go to court, we try to ensure that the dignity of the patient is maintained. We provide medications in a oral fashion. And unfortunately, if the patient is refusing, we want to ensure that we get them back to a place where they're making the best decisions for themselves and others as quickly as possible. Because quite frankly, we look at it as the individual may be having trauma or suffering. So we actually train our staff now in trauma-informed care as well. And we've found that this is very successful in stemming any types of aggressive behaviors. And so we are continuing to roll that out. And OMH right now, the Office of Mental Health, our regulatory agency that we report up to, has just created what is called the Pathway to Trust. It's a therapeutic relations and universal safety training for all individuals working in inpatient settings. And this is something that we're going to be rolling out across our behavioral service line. It's very trauma-informed focus, training our staff that the individuals that are going through these experiences not only can be traumatized by them, but also have had past histories of trauma. We need to be sensitive to that.
Marie, do you have anything you want to add?
Sure, yes, thank you. Couple of things. One is the family to family program that I mentioned. That's for people who have loved ones with a mental health condition. A big part of that curriculum is about communication. So that would be one place to attend that program. And like I said, there's the 90-minute webinar, it's a mini version of that, February 21st, which won't go as in depth, but that's a good place to start. Two other ideas are, we do have a peer specialist who's on staff who answers our helpline, and she's a great resource. So if someone wants to call and ask for questions, you could get that lived experience, right from the mouth of someone who's been there. One last thing is that Dr. Amador has a book called I'm Not Sick, I Don't Need Help. And that's exactly what it's about. The title of the book is well titled, and we have copies here in the office. So we have a lending library. It's right on our website, the whole list of all the books that we're loaning out. And if you'd like to borrow that book, we have that available too. Dr. Amador also often makes his trainings free to NAMI members. So if someone is interested in getting involved in the training, just send me an email. I can put my contact info in the chat, and I can get you connected to some free training on that.
I wanted to acknowledge the questions about the 988 hotline for suicide. I take this as a marching order. Certainly NPW can get out information. Michael's indicated they have information, and kudos to the NAACP in Peekskill for getting the information out. We will make sure that we follow up with this. So I'm going to continue with the questions. Michael, Orth, did you have anything else you wanted to say around the subject that we just left in terms of other resources, or?
No, I think we covered that question.
Great. Is there a list of resources, of all these resources? I would love to share them with my team.
The county has a directory with all the services from NewYork-Pres, NAMI. We have a QR code. We can also punch in the zip code and what service type. So if you go onto our Westchester Gov website under mental health, you will see the directory. There's also a QR code and it lists every service imaginable. We update it annually with all the providers. So that's one tool that you can utilize.
Great. Okay, I'm going to move on. I want to acknowledge Jennifer Flowers from Accreditation Guru, who put some great information in there about 988 communications. I have a question, Michael, that you answered, but maybe just to put it out there for those who are not reading the chat. Is there a resource dedicated to mental health issues for people with developmental disabilities?
Yeah, we talk about co-occurring disorders, and unfortunately, we've done a lot of work in this arena, as Michael and Marie mentioned, regarding mental health and substance misuse. We haven't done as much, not only in Westchester, across the state, for people who may have a developmental intellectual disability. Kudos to WJCS. They've had a longstanding dually diagnosed clinic, and they're always full. And we'd love to expand. It's a matter of resources. Young Adults into YAI also has an outpatient treatment program, but there's definitely a lack of resources. As Michael mentioned, also the Center for Autism is part of their shop as well, and they've done some work around that. But we'd love to really build capacity because it's clearly needed.
I think that's a question here that I think we all basically know, to address the issue of the shortage of mental health providers, and what is being done on the county level to address that. We know that that is a struggle to have people come in to the mental health professional who are linguistically qualified, diverse clinicians. I know that's something I'm sure both Michaels are confronting, Marie as well. Do you want to address that issue of capacity building in the mental health profession?
I'll take a stab, and then Michael and Marie.
Yeah, I'd love to as well. Go for it.
Yeah, I mean, one of the things, clearly, it's a matter of national priorities, and also, as Jan said, we've done a recent study looking at people, actually students entering the field of human services, and enrollment has been down in mental health, substance misuse, psychiatry in general across the area and region. And then also looking at salaries and what is why people would want to enter the field. And to the credit of this governor, she's tried to make up for years of inadequate pay rate increases, COLAs. So to her credit, she's tried to at least take some next steps. And I think all the agencies are struggling with it. It's really, as a society, what do we see as priorities? How do we get students excited to enter this field and give them employment opportunities, and also really looking at it more of a diverse workplace? And part of it starts with, I always ask this question, I started this 2 years ago when I did a presentation to elected officials or other community providers. How do we pay for healthcare in general, right? If we have a broken bone, if we have cancer, for the most part, our insurance pays for a good part of it. When it comes to mental health, behavioral health, there's such disparities with parity rates where commercial insurance is not paying what they should be for behavioral health. Many of our quality community-based providers can't even take commercial plans because the rates are so low. So what do we see as priorities? And that's why it's important that it is a mental health, public health issue, that hopefully it'll give more attention and focus to providing these services. And that impacts the workplace as well. Mike, I know you wanted to add.
That's very well said. I covered some of the points I was going to, but I think the governor, just to go back to the governor, I give her credit for ensuring that in conjunction with OMH, Office of Mental Health, that all licensed beds within New York State that are operating within OMH licensed facilities are able to be filled, right? So there's a sort of an understanding now that OMH will be ensuring that anyone who has licensed beds must ensure that they're online. So bringing that capacity back to the communities has been I think, a focus of the governors. And in addition to that, they're pushing back on any additional bed closures within the community. So if an organization wishes to close OMH licensed beds, they're making it very challenging to do so. One of the things related to psychiatry, and in particular our inpatient providers, it's been challenging through COVID. There's no doubt about it that getting psychiatrists on board through COVID times was very, very challenging. We're seeing a rebound We're very fortunate to have the relationship with two, Ivy League medical colleges, medical universities that allows us to recruit and retain top talent. But quite frankly, we've had to also change our model. We have a fantastic model now that's in place to augment our MDs, and we're utilizing psychiatric nurse practitioners. And that is been a very tremendous successful model for us. And we've had a lot of attention on that model, and we're going to continue to grow that model as well to ensure that we can, again, keep all of our licensed beds at full capacity.
There was a question, is there a psychiatric ER in Westchester County?
Yeah, there's several. They're called 939 receiving hospitals where we can do admission. We have several behavioral health hospitals, NewYork-Pres, obviously, Westchester Medical Center, Phelps, Northern Westchester, Montefiore. Some of them serves adolescents and adults, some just adults. So these are all receiving hospitals. And I saw the question about crisis stabilization centers, and that is sort of a new approach. We're happy that Westchester will have its first intensive crisis residence at St. Vincent's Hospital shortly. That's sort of a step down from psychiatric hospital, or individuals who don't really need the intensity of a psychiatric hospital, but need medically supports. And then there's also a crisis stabilization center that they have in Dutchess County, which is a 23-hour, 59-minute sort of urgent care for behavioral health. And People USA was awarded the funding pending looking at a site and getting that off the ground. So there is a recognition that we want a continuum of care. Obviously, hospitals, as Michael said, they play a critical role. And there's also different levels between sort of outpatient, there's intensive outpatient, there's day treatment. How do we really meet people for where their needs are at? But we still have a long way to go in the behavioral health system as compared to the primary physical health world.
And I think this really speaks to the importance of advocacy, a lot of what NAMI does. And in general, we all can serve as advocates when speaking with our elected officials, when speaking with our friends, and how important it is to make sure that mental health concerns and mental illness are on the same level as physical health concerns.
And Jan, something we can do also as a society is when you look at it from a public health approach, we do a lot of early childhood screening, eyes, nose, throat. There's also anxiety, depression scales that we can either do with the school nurse or earlier on. There's different screening tools that we can do, even our primary care physician, adding an extra couple of questions and really having the skill set to address behavioral issues before they become more significant. Again, it's all part of that universal prevention, early intervention that as a society, we just haven't invested the resources as other places throughout the world have done.
So a couple more questions. Then I'm going to hand it over to Michael Orth to close up. But what steps can a patient take if they want to switch their outpatient treatment team, I guess, from one behavioral health hospital to another in Westchester? How can they identify a new care team at a different facility, outpatient treatment team?
Yeah, Michael, I don't know if you want to take that on from your lens, or Marie. I know for one of the issues that we talk about is choice. And unfortunately, because of the significant waiting list within our county and across the state and country, we don't often have that choice. If you have private insurance and are on a panel, there's probably even less choice. And many of the private practitioners, group practices no longer accept any insurance because of the hassles with dealing with insurance. So that's really been a crisis. But obviously, as a consumer, you can call around and should be a good consumer as well. Michael, do you want to add to that?
Yeah, I mean, happily. I mean, I think all of our outpatient providers would be more than happy to assist, right, in connecting individuals to another level of care or to different providers. The problem is, just as Michael outlined, there's wait lists everywhere, right? So if you're in a program and you're receiving treatment, it's best to try to engage with those caregivers and find a new dynamic with them, but while simultaneously looking for something that is more appealing to you. There is choice that should be had. It's the right of everyone. but to access that choice may be a little bit lengthy in time.
And I do want to reiterate again, the advocacy that is so important, and to certainly get involved with NAMI and understand what the current issues are, participate in lobbying days and advocacy. Providing service is key, obviously, and advocating for change is equally as important, in my opinion. I have a really interesting question here, to close it out before we hand it over to Michael Orth. But with the shortage of mental health care professionals, do you see artificial intelligence or VR therapy playing a role in the mental health crisis in the future?
Yeah, Maria,
That's
obviously there's many different forms of treatment. As I shared before, there are many spiritual, religious organizations that have now faith-based mental health counseling, art therapy. There's other forms of dialectic behavioral therapy. There's so many different forms of treatment and how people can receive treatment. So we never want to limit it to a certain type of construct, so to speak. There's also, I know, Jan, you've worked a lot on racial, cultural, linguistic, and community competence, and we kind of glossed over that, but we see many effective programs in the community. I know there's, Maria's on this call from Yonkers. They're doing some tremendous work with our Latino community, looking at depression, suicide prevention, that are much more culturally competent than some of our more formal services are. So we definitely need to expand. Asian American Pacific Islanders are the second fastest growing population in Westchester, and we know our services are culturally competent. There was a study done looking at evidence-based practices across the country, and sadly, only 6% were people of color who participated in those treatment models, and less than 1.2% were Asian American Pacific Islanders. So if that's our second fastest growing population, and there is no evidence base, we have a lot of work to do with how we deliver those behavioral health services to become much more competent within our communities and our residents.
Does anybody else want to add anything to that?
Well, it's just timely because last week, NewYork-Presbyterian had a kickoff event, annual kickoff event, and we were fortunate enough to have Eric Schmidt, the former CEO of Google, attend and do a session just on AI. So according to Eric, who's I guess a preeminent expert in the field of AI, he was very focused on the fact that healthcare is behind on AI and its usage, but that it is going to be an essential part of our future. And I think in particular for mental health, it'll be a game changer for access to care. I don't believe we'll ever replace the human-to-human interaction that our caregivers provide, but I do believe that there's going to be an opportunity there to advance and accelerate the access to care for those that are looking and seeking and in need of our services.
Wonderful. So again, to Marie, Michael, and Michael, we didn't just get onto Zoom today. There was a lot of preparation for this. I thank you all for your expertise for doing this work. I encourage the participants to use these resources in an effort to destigmatize. I do have to say, my mother was a patient at NewYork-Presbyterian a number of years ago before COVID. And it was really, for a horrible experience, it was a pretty wonderful experience. And there's nothing to be ashamed about. It was life-changing for her. Marie, I know people who have used your programs and have found such a level of support. And then to Michael Orth, who's been doing this for so long and is such a champion for our Westchester community, so well respected in the state and nationwide. Thank you for the work that you do. And as our leader in the county in this area, I'm going to let you close it out. I'm really excited that we started with this and made it happen. And over to you, Michael.
Well, thank you, Jan, and congratulations for launching the series, and appreciate all your work. And it was a real pleasure and honor to present with Michael and Marie. And hopefully all of you have gotten some more information, education. Hopefully it can perk an interest to learn further about any topics that are of interest. And I have to say, I really, truly enjoy spending time with NAMI, because you hear from people who have struggled, who are resilient. And I think we can all relate to that. As Jan said, we all, either ourselves and or have family members who have struggled with mental health. And one of the things we didn't talk about is the importance of us modeling good mental wellness and health as well, and what vocabulary we use. How do we talk about our own mental health publicly or among our colleagues? So all of us have a role to play. So hopefully you will be part of this journey. We're here to help. We're very fortunate in Westchester to have, and many of them are through nonprofit Westchester, is probably one of the strongest organizations in the country who've continued championing this work, but we can always use more support. And please don't hesitate reaching out to any of us if we can be of assistance. So thank you for being here. And Jan, thanks for your leadership.
Thank you, everyone.
Thank you.